Hi, my name is Valley and I'm just going to be doing my lab final. So the first thing we're going to do is I'm going to do a baseline assessment. So I'm going to go into the room and start talking with the patient now. Hi, Mrs. Hernandez, how are you? I'm going to find hand sanitizer somewhere, possibly. Maybe. No, I would do hand hygiene at this moment, but looks like there's none out, so we're just gonna pretend until we can get some. Oh, found some. Okay. We're gonna put this right here. Hand hygiene. So I'm Mrs. Hernandez, my name is Valley, and I'm gonna be your nurse today. So I just have a couple of things we're gonna do today. So we're gonna start with a baseline assessment. This is just to kind of monitor you from head to toe, make sure everything's doing okay, and what I can help you with the best. And then we're gonna end up putting in a Foley catheter for you. You've just been having some urinary retention. We want to help alleviate that so that you're not in pain anymore. And then we're gonna give you your medication for high blood pressure. It'll make you feel so much better. So we're just gonna be doing all that. But I'm gonna start with your baseline assessment right now. So the first thing I'm gonna do, goodness, I can't breathe. I'm gonna raise the bed. I'm gonna raise this to a comfortable working height for me, so that I don't hurt my back because I'm really tall. Okay, and then she can be sitting up for partially the assessment. She's gonna put her legs down. Is that okay for you? Okay, perfect. So we're just gonna first start off by talking to her. So, hi, do you know who I am? I'm your nurse. Do you know who the President of the United States is? Yes. Trump, perfect. And then, do you know where you're at? Yeah, you're at the SVC hospital. Perfect. So they know where they're at, where they are. They're alert and oriented. Everything's okay. So the second thing we're gonna do is I'm gonna start. Excuse me. Goodness. Okay, we're gonna start with. Goodness. We're gonna start with a pain assessment. So they're having some pain in their left arm. Is that where that you said? Right here? Their left upper arm. They're just having a little bit of pain. They just said they kind of hit it the other day and it's hurting. So the characteristics, what is it like? So what is the pain like? Is it sharp? It's a sharp pain when you move it? Okay, and you said it started just 2 days ago? Perfect. Like what is like the duration? Does it continually hurt or does it just hurt once in a while? Just when you're moving it? Okay, that makes sense. Okay. So does it like radiate anywhere? No? It just is right in that place? Okay, perfect. Does it anything else like help it feel better? Yeah, just ice and ibuprofen? Okay. Does anything else make it hurt worse? No? Just moving it? Okay, and then is there any other associated symptoms with this? None? Okay, perfect. Okay, so then we're gonna start, I did that and we'll assess the pain later. So now we're going to do her head assessment. We're gonna start with her head. I'm just gonna end up filling. I'm just gonna fill right around here, just really softly and around your head. I'm looking for lumps, bruises, bumps, any problems. Have you felt any problems as of lately? You haven't? Okay, tell me if you feel any tenderness. Perfect. No tenderness so far? Perfect. I'll try to be really careful. Perfect. Anything hurt? No? Okay, good. Okay, so now I'm going to be checking. We're going to start with the ears. We're just looking in the ears. We'll walk around to the other side. Excuse me, I'm sorry. We're going to walk over to the other side. Make sure I can see the ears. Let me put this down and make it a little easier for me, but I'm right here, so the patient's okay. We're going to look in the nose, no redness in the mouth. Will you say ah? Perfect. Okay, now we're just going to do a little test with your eyes. Excuse me, I can't breathe. Okay, I'm going to have you look at my finger, and then I'm going to have you just follow my finger. And then I'm going to do this, and that. Okay, follow, I guess I could do the pen. Oh, excuse me. Follow this. Just follow the tip of the pen. And then we're just going to go like that. Okay, so the eyes, the pupils are equal. They're reactive to light and accommodation. They're oriented. Everything's working really well. So it looks really good. Okay, the second thing I'm going to do is I'm going to go down and fill just around your neck and your upper chest area. And Tell me if you feel uncomfortable or if there's any pain, okay? No pain? Okay, perfect. So the next thing I'm gonna do is I'm gonna test out this. So I'm just gonna be listening to your heart. So I'm gonna go in a couple different places. You can just do everything as normal, and I will go and do that. Okay, so there's an aortic right here, pulmonic, Erb's point, tricuspid, and mitral, and I would listen to the mitral for 1 minute. But they all sound great. Your heart rate is regular, the beats sound good, no irregular beats. Have you been having any chest pain of any kind? No? Okay, perfect, that sounds great. Okay, so now I'm gonna listen to your lungs. Every time I set down this stethoscope, I just want you to have a big deep breath for me, okay? Okay. Ow. 2 seconds, okay. Okay, I'm gonna start right here, and I'm gonna be doing it 6 times, 3 on each side, and then we're gonna do it on your posterior side, and we're gonna do it 6 times on the back as well, okay? Okay. So we're gonna start right here. Big deep breath. Perfect. Okay, big deep breath. Perfect. Big deep breath. Okay, now we're gonna switch to this other side. Deep breath again. Another deep breath. Another deep breath. Okay, now this patient is gonna help me sit themselves up. We're just gonna lean forward a little. This patient completely can do that. It's just gonna be a tiny bit difficult because of this, obviously. Let me put this back on. Why I took it off, I don't know. Okay. How heavy this one is. Oh, we're good. Okay. So I'm listening to the same place. It's kind of hard to see in this, so I'm listening at the top part of the back. Big deep breath. In the middle part of the back, move their hair. In the middle part of the back. And then I'm gonna listen over here on the side. And then I'm gonna do the same thing on this side. Big deep breath. Big deep breath. Big deep breath. Okay, perfect. We're just gonna lay down gently. Perfect, everything sounds good. There was no crackles, your lung sounds are clear. Do you have any pain when you breathe or anything? No? Okay, perfect. Alrighty, now I'm going to lay you flat. Okay, and if you're okay with that, I'm just gonna feel in your stomach. You're okay? Okay, perfect. I'm just gonna bring this down. And are you okay if I just bring up your dress just a little? Your dressing? Okay, perfect. Alrighty, perfect. So the first thing I'm gonna do is I'm gonna listen to your bowel sounds. I just wanna be able to hear them in all 4 quadrants. Okay. Right upper, right lower, left upper, left lower. I heard bowel sounds were present in each quadrant. Okay, now I'm just gonna hurry and palpate. If you're having any tenderness or pain, will you let me know? Okay, perfect. I'll be really gentle. Palpate each quadrant as well. Everything felt okay? Perfect. That's perfect for me. I'll get you a little bit more modest. Okay, and then I'm just gonna, we can stay laying down for this. Okay, so now I'm gonna feel around. I will be careful with the patient's left upper arm because they were having pain there earlier. We don't want to hurt them anymore. So I'm just gonna feel around on their extremities. Very careful on the arm. You having any pain? No? Okay, we're gonna pull this down, if that's okay with you, just so I can get to your feet and everything. Perfect. Okay, just so I can see everything. And I'm gonna feel your legs. If you feel any tenderness, please let me know. Any tenderness? No? Okay, perfect. So now I'm gonna check the turgor. Just a little tiny pinch on the skin. It's just to check for hydration. Check the turgor. Turgor's great. Okay, I'm gonna check the capillary refill on their finger first, and then I'm gonna check their feet as well. Less than 3 seconds. Less than 3 seconds. Okay, now I'm gonna feel this I'm gonna have you give me your arms, and we're just gonna feel your pulses. Super easy. Nothing crazy. Okay, their pulses are great on both arms. They're equal. Now I'm gonna feel their pedal pulses. Perfect. Everything's equal. They're also covered. Okay, now I'm gonna have them just do some reflexes for me. Will you push against my hands for me? Perfect. And will you push up? Perfect. Or will you please push, just hold my hand, squeeze them. Okay, and then I'm just gonna have them push against my arm the best they can. Okay, everything seems good. I would have done any vital signs before. We have the vital signs. They're great. We'll check up on anything that needs to be checked up on as we go along. Okay, so that's about it for our baseline. Any other things that we need to do, we will do. Do you feel okay right now? Yeah? Okay. Oh, that's the wrong word. Okay, we're just gonna put them up just while we're transitioning to other things to make them feel comfortable. Okay, I'm gonna do hand hygiene. Okay, perfect. Now I'm just gonna check on the order one more time, make sure everything's good. Okay, now the second thing we're gonna do is give her a Foley catheter for urinary retention. So I'm gonna get everything set up right now. I don't know if I was supposed to do that before or not. I'm gonna use this for my sterile part, just to get everything set up. Oh, yeah, perfect. I'm gonna get 2 pairs. Okay, and then we're gonna make sure I have everything around this. Like this, to the whole back cloth. This. Oh. Make sure it says Foley. Oops. Let me make sure it says this. Sorry. Okay. I'm making sure I have everything to make sure I'm comfortable with what I'm doing. I feel pretty comfortable, and I'm just gonna make sure I have a pair of gloves over here, but there is one right here. I'm gonna come over here, and I'm gonna go on that side of the bed because I'm right-handed and it's just a little bit easier for me to move around and stuff. So I'm gonna move everything over there really quick. I'm gonna bring the box of gloves over just so I'm a little bit more comfortable and I have them at least close. Okay. So, hi, I'm back, Mrs. Hernandez. Yeah, the doctor ordered you a Foley catheter for urinary retention. I know you've been having a lot of pain, distended stomach. That is what it's really happening. It's just your bladder. It's a little full. So that's what we're going to be doing today. Okay, so I'm just going to have you I'm going to lay you down completely. And I have you up at a good working height for me. Oh, that's not what I meant to do. I'll put you back up at a good working height for me. And then I'm going to put your noggin down and your feet. Make sure everything's down completely. Okay, so what I'm going to do is I'm going to lay you flat. This is a little bit of an uncomfortable procedure. I completely understand that, but I am here to walk you through the entire thing and help you out. Okay, are you okay if I bring this down? Okay, so now I know this is a little uncomfortable. In all of these, I would provide privacy and I would check for any allergies or medications, so that's what I'll do now. Should have done that on the very other one, but that's okay. I provided privacy, shut the door, shut the curtains. Do you have any allergies to latex, iodine, anything else? No? Okay, perfect. That'll work out really well. That matches with the MAR and everything, so that works out. So the first thing I'm gonna do is I'm just gonna get her ready. Before I do anything, we're gonna clean her off for your urinary catheter. So we're gonna be doing just some care on you. I'm gonna put this down just so I don't hurt myself. Okay, and I'm just gonna get this ready. 2 seconds. I guess I can just rip these ones. Okay, we're just gonna rip them. Because why not? Okay, are you okay if I expose you just a little? I know it's uncomfortable, but it's only us. Oh, you're okay? Perfect. Okay, now I'm gonna put her in a dorsal recumbent position, but this doesn't do that very well, so we're just gonna kind of try to make sure it's open and ready. Okay. I don't fight with the wipes. Make sure I have this right here so that I can use this really well. Okay. Okay, so the first thing I'm going to do is I'm going to make sure I have this already, and I'm going to be wiping it. So I'm going to wipe a couple different times, each swipe a new wipe, like a different place on the wipe or a new wipe. So I'm going to start right here. I go right there. Different part of the wipe. I go right here. I can toss it and get a new one. Maybe doesn't want to fight with me. Okay, and then I'm just gonna go straight down the middle. Perfect. Okay, I wiped, and I'm gonna make sure to wipe the rectum as well. And just everything, make sure everything's good. Okay, everything's really clean. So now I'll do this. I have good lighting when I'm doing everything. I have good lighting. I have enough space to get there. I'm just gonna toss these to make it easier for me and do hand hygiene. That's all the way over here. But I have good lighting when I'm doing everything. I feel really comfortable. There's no problems. And I'm gonna take this off as well just to make it a little easier on me because it's kind of just sitting there. Okay, now I'm gonna prepare my sterile fill. I'm gonna try to do this the best I can on this small of a table. So I have another thing just in case I do need them and I break sterile fill. Oh my gosh. And you're gonna see me struggle to open this. Okay. Let me open this. Okay. So luckily, this is a 5 ml silicone Foley catheter. I'm just gonna make sure to toss everything as I go because I don't have a lot of space. I will be keeping this. This is for when at the end I will put it on my bag and everything to make sure everything's been inserted, the date, the time, the nurse that did it, which is me. This is supposed to be this way. I open it away from me. And I have a 1-inch a little border around the end. I can use it that is not sterile, but this is a sterile technique, so I will be doing my absolute best to keep it sterile. One thing I won't do is I will not turn my back on my sterile field, and I will not put my hands down once it's up. Okay, I'm going to be doing this. This is my sterile gloves. We're going to see if I can use these ones. They're very wrapped up, so let me get them all wrapped. I still, once again, do have a 1-inch sterile field around this. A 1-inch field that is not sterile is what I meant, excuse me. And I'm using that. I am not touching within that. Okay, so I did mess up this one a little bit, so that one a little bit, so I will use my sterile glove to get to that one. And right now I will just make sure I have it in the right place. And I'm touching the inside of the cuff. I do not touch the outside, so I do not break sterile field. Okay, this one I will go, make sure this is in the right place. We'll go on the inside of the cuff for this. Inside of the cuff. Excuse me. And once this is on, I can fix my fingers just like this, because now I'm sterile without touching my hand or anything. Perfect. I'm going to bring this and just slightly drop it. I'm also going to bring this the tiny bit closer to me without turning my back to my sterile field. I may have just done. Okay, now my field is still sterile. I'm going to get everything ready. I'm going to set this down. I'm just going to drop it, and without touching the skin, this is also sterile. I bring this down slowly. This is just to keep a sterile field within. Much easier for me. I am touching everything and making sure it's still sterile as I go. I'm going to put this on. I'm putting this just so I can keep, without touching any skin or anything, I keep my hands within the sterile field. Perfect. Everything is still sterile. Now I will get this ready. This is also for the bag to do everything with. I have a lot of stuff, so luckily I have a lot to help me. I'm going to keep everything within the sterile field as best I can without touching the 1-inch border. Perfect. Okay, I'm going to get everything ready for me just so I'm comfortable. It's wrong side. this so uncomfortable? Right there. These are swabs that are open. And I'm gonna get those ready. This is where the urine specimen that we are gonna take can go. Okay, now I'm gonna get this. Ooh. And I'm going to make sure put my saline on here. Okay, this is for when I fill up my balloon. Okay, now I'm gonna get this, and I'm gonna try to keep everything in the box because that is the way I find the easiest and most comfortable. I'm gonna pull this off really slowly so it does not fall and we do not break sterile field. Perfect. My trash can closer. Right there. Close enough for my turn. Okay, keep my eyes on the sterile field. This is my lubricant. I'm gonna be lubricating the first. Ooh, there we go. First couple inches, but I will just leave it in the lubricant packaging. See, we're gonna lubricate this to make it a lot easier to go into the urethra. Hi, Mrs. Hernandez, how are you feeling? I know it's a little nerve-wracking of a procedure, but I promise you I will continue to walk you through it. Okay, I'm gonna drop this in my sterile field and make sure this is all sterile. Okay, perfect right there. Everything's still sterile. Okay, so the first thing I'm gonna do is I'm gonna get my wet and Q-tips, my clean ones. I want to get them all ready for me. If I can get the third one out. Stuck. Okay, I just have these right here ready for me to grab. Okay, I'm gonna put my hand on the fetus. This will make my hand non-sterile, but I will not be using it for any more sterile technique after that. So, first thing you want to do is I'm gonna make sure this is open. I go on one side of the meatus. I toss this. I go on this side of the meatus. Toss this. I grab this one. And I'm gonna set this off. And I go straight down the middle. And I keep, this is to keep everything sterile. Okay, now I am going to take this out. There we go. Take it out. Okay, on 3, I'm gonna insert your catheter. I just want you to do a big deep breath. Deep breath. Okay, I see a flash of urine and I advance a couple more inches. Okay. I keep that as my non-sterile hand. I keep that and I do not advance a catheter anymore. And it does not need to be advanced anymore. I'm now gonna put in 5 ml of saline, and this is a 14 French. This is, okay, I don't want to spray you, so watch out, because I always do with these. Okay, ooh, very good. Okay, this is no longer sterile. Nothing's sterile anymore. Everything's clean, everything's good. So now I can do this, pull, perfect. It's been all done good. Okay, now I'm gonna remove this. Goodness gravy. And I am good. Now I'm gonna use my regular gloves. Excuse me. And I'm just gonna start cleaning up around the patient. If I would have sprayed any of the saline solution or anything of that sort, I would have cleaned up the patient, you know, make sure that they have no wetness on them, they're dry, comfortable, but I did not. Kept it pretty good. Look at this. Ooh, rolling. Goodness gravy. Stay. Okay. Now, since I have that all cleaned up, I can use this, and I'm gonna take this. So, I can go look, but I did not see a strap to the leg. I'm gonna hurry and go look before I do anything. I did not see a strap to the leg, to put on the leg, unless I just didn't see it. Okay, so I'm not seeing one, but we would typically have a strap and we would tape it to the leg. It's just a little sticky film. It has a little thing that would go on it, and I would just put about, probably, usually depends on the catheter, but around there here on the catheter, and to make sure it has enough place where it's not doesn't have tension on the catheter, so it's not pulling, causing any pain or anything. We want them to be really comfortable and don't want them to be pull out their catheter because that's not a very fun experience for anyone. I'm also going to do hand hygiene. Oh, and I found one that's so much closer to me. So much easier. Okay, I am going to stick this on the back. Oops. That's lovely. Stick this on the back. I'm going to put this around. Put this on the non-movable part of the bed. Right there for 2 seconds. If we needed a urine specimen, since this is new, we could use that bag just for the first urine specimen, example, whatever you would like to call it. But after that, you would go up here and we would get a urine thing from there. Make sure this is not clamped, the tubing isn't clamped. The thing, there's a little part in the bottom, a little spout. It was closed the entire time, I made sure. So everything should be good. How are you feeling? Okay? I know that was a little bit of an uncomfortable procedure, but I'm so grateful that you have it done and it makes you feel so much better. How are you doing? Okay? Okay. Now, I'm just gonna go get your medication ready for you and then we should be okay. Let me do that. Are you comfortable? I will put them to a little bit of a lower position. I'll put them to the lowest part of the bed, make sure they're comfortable, everything like that. But I will still be in the room, so I'm not extremely worried about anything like that happening. So I'm gonna do hand hygiene once again. Okay, now I'm gonna go over here, everything around, and I'm gonna get. So sorry, Mom. We're gonna say we're in the med room because it's a tiny bit easier. Let me get into my. Well, that is not it. Excuse that. Okay, so that's kind of cool. Oh, there we go. Final one. So we're gonna check the name, Mona Hernandez. I did just realize in this entire thing, I would check her ID band and do 2 forms of identification. I would do her birthday and I would do her full name, everything like that. Sorry I didn't do that, but I do remember that now. So, okay, Mona Hernandez. I'm gonna push on this. Okay, so now we're gonna go into her orders. Okay, so she's not having any allergies. I will ask her that as she goes in, but this is what the chart says. She takes lisinopril at home for high blood pressure. She's alert and oriented. Everything's good. So we're gonna give her pressure and give her medication for blood pressure and ibuprofen for a headache. Okay, now we're gonna go find her. 2 seconds. So on here, the order, it says 650. Make sure, antimethamphetamine dosage. So it's 650 milligrams every 6 hours. So everything's looking good. Make sure what hours was I taking. Okay, her vitals are good. So I will get that ready. 650 milligrams. Okay. So let me 2 seconds. I feel it in my arm. Okay, antimethamphetamine. 650. Okay, so I will get this ready and then I will do all my 3 checks, but I'll do 1 check as I get it ready. Let me get it ready. This is ibuprofen. It's not. Acetaminophen, 360. And I'm just gonna check. This is 350, so I will be able to give them 2 capsules of this. I will get it all ready. Here's the cup. This is just the med room that we were doing this in. Okay, I will give them 2 capsules because 325 plus 325 is 650. We'll get that ready. That is 1. And I'm only preparing medication for 1 person at a time in this entire thing. Nobody else. So making sure it's just for Mona Hernandez. Okay, so I will get these both ready, but I will do them 1 at a time on this. Okay, now we're gonna get the lisinopril hydrochloride. I'm just gonna hurry and look this over and make sure that I'm completely comfortable giving this. It's inside my scope of practice. Perfect. Okay. I'm gonna just hurry and check this out. This is to lower blood pressure. I'm just going to check to make sure they don't have any dizziness, headaches, any adverse reactions going on, no hypotension, no diarrhea, nausea, anything like that. This looks really great. Yeah, and you're not supposed to take it if you're pregnant, so I will make sure of all of that. As far as I know, I do not have any problems with any of those. Okay, and this is 12. 2 seconds, sorry guys. Making sure I have everything right. Okay, we're gonna find everything. Good. I'm gonna make sure this is the right thing before I give it. Perfect, and we just give her 1 tablet. This matches up with the MAR. I just checked that. I will make sure to get, and I can just put this in with the ibuprofen. It works. That's okay. I will give her 1 tablet, but I put it in this medicine first so I do not touch it. And I will put it in there. Perfect. This is going back into a locked medicine cabinet. We don't need to worry about it. I have everything with me. We'll go in and see the patient now. Yes. Mrs. Hernandez, how are you today? Good? Perfect. Okay, so what we're going to be doing for you today is we're going to be giving you some of your medication. So I heard you have just a little bit of a headache, so we're going to be giving you some ibuprofen, and then I heard we have like high blood pressure, so we're going to be giving you lisinopril hydrochloride. So I'm going to check your patient ID just one more time. I know we do this all the time. Okay, Mona Hernandez, your order matches with that. Perfect. Okay, so I'm going to confirm. And I'm going to hurry and take a quick minute, and I'm not supposed to leave my medications. I'm going to be with you because I don't know who forgot to get the scanning thing. But, yeah. Okay, now I have this. Jeez, Mona, I did not mean to do that. I'm so sorry. Okay, I'm gonna get this all set up. Okay, it's all set up, perfect. Okay, so I am going to scan the patient barcode. Okay, everything looks good, as we said. Okay, now, so I'm gonna make sure I have the right person, the right medication, the right dosage at the right time, everything like that. We just wanna make sure it's the right route as well. And these are all the things, these are all correct. So I'm just gonna continue doing that as I do that. We're gonna scan. We're gonna get the medication and bring it back over because we have to scan the code on all of these. Lisinopril. And we will just put these right here. And then got it. Makes sense. Okay, and right now we are doing Lisinopril. Okay, the dose, the right time. I have completed my few checks. Everything looks good. Okay, so now I would make sure that these are all good. And I need to go back and do the ibuprofen and make sure it's administered at the same time. Probably should not have put them in the same pill thing. I'm just gonna get one more because I am just doing so lovely. Okay. And I'm gonna make sure that I do this correctly. Since these have touched each other, I just don't want to put them back in the medication bottle. I don't want any problems. So we're just gonna try to, perfect. Works so well. Okay, now we're gonna be giving you your blood pressure medication. And this is Lisinopril. I'm gonna make sure your head's up. Not heads up, maybe. Nope. There we go. And make sure your feet stay down. Okay, and I'm gonna get you some water. Okay, you don't have any allergies to medications as we confirmed? No? No allergies? Nothing? Okay, as I said, this is all in privacy. Everything's good. Okay, perfect. So you're gonna take this, drink some water. Perfect, everything is good. Now I'm just gonna give you your water, put it in your hand, and then we're gonna go and push it in the register. And now we're gonna do the acetaminophen, 650 milligrams oral, PO. So now I'm going to scan the patient. It's already been scanned, so everything's okay with that. So we have the right medication. This is acetaminophen. Perfect. Make sure that is right there. I've completed my 3 checks. This is the right patient. Everything matches up as I've checked before. This is also my other time checking. Now it's time. Give it. Okay, are you ready? Will you just take some sips of that water when you take this? There you go. Okay, perfect. Everything looks good. Tell me if you feel okay. Okay, so we would have had all the previous things done before. Like we said, with our baseline check, we would have done our vitals, made sure everything was okay. She's doing well. She feels okay. Everything is going well. And I'm just gonna lower her gun. Make sure she's in a comfortable position. I'm gonna come back and check on her catheter as well as her, make sure she has no adverse effects in about 30 to 15 minutes. So if you are having any pain with your catheter, let me know. Please don't do any pulling. Try to keep it as minimal as pain as possible. If you are having pain though, please let me know. If you're feeling any dizziness, if you're feeling like you can't breathe, let me know. I will come in and we will figure that out. That's just a thing that could happen with the medicine. But you seem to be doing really well right now. I will come and check on you. And